Mayor of Birmingham. Mayor, I'll just say on the front end, I appreciate you taking the time. If you have to go, you have to go. I understand. So anytime we have with you, we appreciate, and thank you so much. Thanks for being here today.
Hey, Doc, I'm happy to be on. I hate it took so long to get here, but I'm happy to be here with you. Let's go as long as we need to.
Okay.
Be with you and your audience.
So first of all, Mayor, you know, I appreciate what you do, public service, and you do a great job, and I appreciate you taking the time with our Doc Talk Live community. I understand, and it seems that Birmingham has really led the way, or has been in many instances ahead of the curve when it's come to enacting the shelter-in-place ordinance, and I'd like some insight into how we've become more on the front end of the curve as opposed to the back end of the curve from this public health standpoint.
Hey, Doc, I think it's a combination of things. The first thing is this: I have this belief that I needed to do everything to save lives, anything necessary in my legal purview to save lives. My team and I was willing to not only explore it, but execute on it. I didn't want to wake up and have a run on a nursing home. I didn't want to wake up and have a run on a church congregation. And I had, if I'm honest with you, I had some fear and anxiety of thinking, what if people just were dying in the city? And I didn't want to bear that. I didn't want to live with that. And I wouldn't be able to sleep with that. And so I thought it was important to do everything necessary to save lives. I mean, that is what that's rooted in. The second thing is this: I know my limits. I am an elected official. I have a political science and a legal background. I don't have enough health background. So I thought it was important to not only listen to Dr. Mark Wilson, who's the head health officer of Jefferson County, but also to listen to Dr. Will Fernandy and his entire team of UAB Health Systems. Combined, the health department and UAB Health System have shared, listen, this will be serious. It will have an impact on the community if you don't do these things. So taking their recommendations and then knowing what I could legally do and not do, I took all of that and said, this is what we're going to do to save lives in Birmingham.
I imagine that you have gotten quite a public health and medical education in the past few weeks.
I have. And I'm still not an epidemiologist, but yes, I have.
So I'm curious, and this may be a question I should ask you later on in our discussion, but I'm curious. You know, hindsight is always 20/20, and these times are very stressful because it seems like the information that we get as consumers, as individuals, as citizens, changes not day to day, hour to hour.
Mm-hmm.
And so I'm curious how you get this information, process it, and what you would have done differently, or if anything, with regard to this at this point. And I realize this answer could change 5 hours from now.
Well, there are a couple of things. I think the first thing is this: since we've been in office, I've always been a sponge. So the ability to absorb information and then absorb it from a lot of different points of reference and a lot of different people who view things differently. And so whether it's a team of rivals or just a team of high caliber people who are bringing in all this information and recommendations, my job is to process it, synthesize it, and then make the best decision. And you're right, this is not only a health crisis, but in the middle of this health crisis is one of the most fluid things I've ever been a part of, where it's literally changing. Those first 2 weeks, there was something every hour. It was literally every hour. It wasn't 24 hours then a change. It was every hour there was a change. I think now that we're in the 5th week of this, if there is hindsight, it's this: having the ability to work with the state and the federal government of making better decisions too, so people wouldn't say, "Oh, the city of Birmingham is overreacting to this." You wanted more buy-in from day one from the community, so people could know that we needed to take this seriously. And I think that would have been better if we had help at a higher elected official level.
From a medical standpoint, and this is just sort of my sort of looking at the situation, I find that testing, not being able to test in an efficient way has been a problem in terms of really identifying the asymptomatic positive people, and stopping this from spreading. If I had to make level one criticism, and it wouldn't be with you, it would be with the whole situation in general. I kind of feel, and again, I don't have insight knowledge into how the CDC runs or how public health runs, Mayor. But testing seems, and it's still ramping up. I still think that we're still struggling with testing people.
I think so too. I agree with you. You know, I will say this. I think the more testing available, listen, there's no distance in what you said and me agreeing with you. I think from day one, we know that the conversation kind of went like this. There's not enough testing. And then we put up one testing site. Well, everyone can't get to it. Okay, we put up a second testing site. Well, that's still not enough. Okay, the next thing was you should only test if you have these symptoms, or you know someone that's tested positive, or you have a doctor's excuse. Well, as you said, the asymptomatic people, which is probably the majority of Americans, those are the people that need to be tested as well. So I am happy to see that there are more testing sites available. I'm happy to see that the city's played a small role in creating a call center to engage people and to encourage them to get tested. And I am happy to say, as of today, we've even played another part and role in making sure people have access and transportation to testing.
So speaking of testing, say a little bit more about that. Who should people call? How, if they're interested in getting testing, what is the easiest way that you know of to go about that?
Doc, you have to forgive me because I don't have the information from memory, but we now have 3 testing sites in the city limits of Birmingham, one on the western side of town, near Princeton Hospital. We also have a testing site on the south side of town that actually may have transitioned out of being a testing site. And then we have a 3rd testing site over in the Woodlawn neighborhood, a block away from Woodlawn High School. I can make sure I follow up with you and your team for your viewers to have the actual addresses of these 3 sites, as well as a phone number to call, because I know with at least 2 of those sites, you definitely have to call before. They don't just accept walk-ups.
Right, you have to have an appointment. Yeah, that would be great. Maybe one of your media people can get that to me, and I'll get it posted on the Doc Talk Live page.
We'll take care of that. That's important. But I think there's another step here. We needed to solve for certain vulnerable communities, i.e. those that are in the homeless community and those that are in more densely populated areas such as public housing, where the good news is it hasn't been rampant for those testing positive or flowing through those communities. But at the exact same time, people need to still know there's available testing. So we co-created a call center that allowed people to engage those populations and communities. In addition to that, as of today, we've now partnered with UAB and the Be Strong organization and others that have created some form of a safe vacuum seal to transport through personal vehicles those who may have symptoms of being sick to get tested. So we can get people not only from point A to B, but we can also provide that service and pay some form of a stipend to those drivers, and all while protecting that driver from being able to contact the COVID-19 at the same time.
Frank wants to know if you know what the test costs, and any comment on the cost of testing.
These 3 sites, there should be no cost to testing, because I've been referring and recommending people to get tested at these 3 sites. And if anybody had a problem at these 3 sites, please let me know. But there should be no cost attached to these 3 sites in the city limits of Birmingham.
So you mentioned Birmingham Strong. Can you tell me a little bit about what Birmingham Strong is?
Great. Well, we just executed on the second phase today. Beham Strong overall is a goal to support the community. There's several lanes in community. The first lane is our small businesses and the hourly workers. And so we know that the COVID-19 coronavirus did not only create a health crisis, but at the exact same time, it created an economic crisis too. And when the Jefferson County Health Department had its order to shut down certain small businesses within the city limits, it created a ripple. And the first ripple was for the pinch and hardship it caused that small business owner. Then the second hardship it caused for those hourly workers. And believe it or not, it's causing a hardship for the city of Birmingham that's also dependent on these community partners. So there's a lot of codependency as it relates to this adverse effect that the COVID-19 crisis has created. Well, Beham Strong sought to be a form of a bridge as well as relief. Bridge relief in the short version is a public-private partnership that created resources that allowed monies to go directly to small businesses who have been adversely affected by the COVID-19 in the form of a loan program from anywhere from $10,000 to $25,000 that allowed them not to be in a position to have to pay that back within 6 months and no interest within those 6 months. And that's turned out to be now in a phase where we're rolling out that program through an organization. Well, not we, but BBRC is managing that with a gentleman by the name of Bob Dickerson.
Because the internet connection, Mayor, because the internet connection is not strong or perfect, I'm going to repeat some of what you said, and you correct me if I'm wrong. I might have a better internet connection. But bhamstrong.com or Birmingham Strong is a private-public partnership that has been put in place because of COVID-19 to help small businesses and unemployed people during this time. Is that correct?
That is 100% correct.
And the way it does that is by providing loans that are interest-free for a period of time? Or tell me about these loans.
Interest-free loan for 6 months.
For 6 months. How does it help the unemployed person or the person in the restaurant that's lost their job how does it help that person?
So the second phase of the Beham Strong Fund and program is this. The short version is the COVID-19 has created a position for us to look at the flaws in certain systems. Some of these flaws exist around food insecurity. They exist around access to get testing. And then it centers around actually the ability for people to know that testing is available. So for those unemployed hourly workers, we've created an opportunity for them to either participate in one of three lanes. I want you to imagine the AmeriCorps Vista program that is actually a service program where people get a stipend and they build skills. So it's not full-time employment, but they're still able to be paid. Well, this is very similar to that. This is a service project in three lanes that addresses either food insecurity, addresses a form of a call center, or addresses those that can be drivers for testing to take people to testing sites. All three of those things range in a minimum of $12 an hour, and people can work a certain amount of hours a week to be paid. And the only requirements are that you live in the city limits of Birmingham and that you've been laid off from work because of the COVID-19.
What about the person who's sort of self-employed? Let's say my housekeeper, for example, Mayor. Let's say my housekeeper is no longer able to clean houses because everybody has sort of a different sort of concept of social distancing, but at the extreme, you're not allowing, let's say, your housekeeper into your house.
If you're a housekeeper, who I imagine is probably an hourly worker, has been furloughed from engaging in her duties, then she or he can participate in the Be Strong program, and based on existing skill sets or skill they want to build, they can fall into one of those three lanes of either of doing service related to COVID-19 in the call center, which is a virtual call center. They don't have to come in to do that. They can still do that work and be paid from home. They have a second option. These options are in no particular order. They have a second option of actually supporting and engaging in the food insecurity part on the food prep / food delivery. Then the third part, the third option that is making sure that for the actual testing types that exist, we are providing the ability for a person that needs to be tested but doesn't have adequate transportation to get from point A to B, and he or she, the example you gave, could be a driver and be paid on an hourly basis.
Now, is Be Strong your baby, or is this something other cities have rolled out as well? How did we get Be Strong?
This is unique to our city of Birmingham and our community. I'm unaware of any other community doing this. I think the thing, how do we get here, is very simple. I looked at my team and I told them, in this crisis, this is the time to show a lot of ingenuity, as well as be extremely creative and innovate, and to find a way to get the guests as it relates to either keeping people employed or giving people some type of assistance while they're unemployed, or being in a position to provide for and assist those who need help during this crisis.
So let's take this a few weeks forward, okay? I understand that we're starting to flatten the curve out, that things are perhaps looking better with regard to COVID as it relates to our city. Is that accurate so far?
I think from a health standpoint, what we'll see is probably a peak within the next 5 to 8 days. In the ideal world, after these next 5 to 8 days, that definitely means that we could be in a better position as it relates to those getting the COVID-19, testing positive for it, or not testing positive for it.
So in a few weeks, we start going back to business as usual, hopefully, and we start coming out of this isolation period. What's to prevent this whole thing ramping back up again and be right back where we were or where we are right now?
Well, I think there are a couple of things that human behavior has changed, right? I'm a hugger and a handshake, and I like to shake hands. And I have, it's taken a lot of self-discipline of me to not want to engage a person by extending my hand,
right,
or to hug them.
I showed you my elbow. I'm giving you my elbow.
The elbow dab. I think you may see some behavior where the elbow remains intact, that you will see people less likely to shake hands or hug people, especially who are defined as a stranger and not their family. I think you will see people remain vigilant in keeping hand sanitizer with them and frequently using hand sanitizer and washing their hands post this. I think you will see people
wearing masks now.
I think you will see more people wearing masks. Even in our buildings, I think you will see us continue to not only to the whole idea of keeping hand sanitizer inside the elevator and outside of the elevator, keeping more doors open automatically so people don't have to touch the doorknobs or push the doors after other people. So I think
we're going to come out and be a cleaner, just deal with things a lot cleaner than we have in the
absolutely
past. Okay. There are some comments that I don't think you can see, but I just want to make sure I get to the Facebook audience that are watching this and let you know that they support you. One person just says thank you. Another person says excellent. Another person says Public Works is still working. What can citizens do to protect public servants that are still serving?
That is a great question. The number one request I have of our citizens, apparently enough citizens are still going outside of their homes for essential services. They're going to a grocery store, a big box store, or Walmart, Lowe's, Home Depot. etc. The best thing we can do for our public works employees is stop using trash bags. If you actually don't have a trash can, I want to encourage our residents, please purchase an actual trash can.
I'm lost. Don't use trash bags?
Don't use trash bags, no.
Well,
So long term, eventually, we need to get to a point like other cities. Other cities have what's called uniform trash cans and uniform trash bins and uniform recycle bins and uniform recycle cans. And instead of two men or two women hopping off the truck, they use a uniform trash bin and a uniform lift. Well, if you had a lift, then there's less exposure to our employees engaging using their hands to pick up people's trash. And if they're still going to pick up trash, then it's safer to pick up from an actual can versus picking up the bag.
All right, I'm going to have to break this down. I'm sorry to be a little dense, but I rent a townhome. It's not my place. I rent it, and outside the townhome I put my garbage in the bins.
You're good.
But so I'm sure the trash man has to come and pull that stuff out or throw the bins in the truck. And this is in the city of Birmingham. There is no thing that's done automatically where I live.
So the good news is there are 26 routes for refuge pickup in the city of Birmingham, Monday, Tuesday, and Thursday and Friday of each week. For each household, we pick up trash two times a week. We as a city ultimately long term need to transition to having a uniform trash cans and having a lift.
Okay.
In the short term, we have 2 of those 26 routes that are on a pilot program. So 2,000 households on 2 of those current existing routes this month, in the month of April, started a pilot program. This pilot program picks up trash 1 day a week with uniform trash cans. And picking up the trash can versus the trash bag, there's less exposure for contamination and other things that are in our households.
Got it.
That our public works employees would be unaware of.
Got it. All right, I'm going to read another comment. According to major news outlets, several state governments are starting to lay out selective reopening plans.
Right.
Can you give any updates on such plans, if any have been formulated for Birmingham?
The answer is locally we have not started to talk about any of those plans, and here's why. If you notice, a lot of that conversation is centered around elected officials and politicians at the federal level with the president, and at some of the state levels with our governors. I want to tell people, and I think it's important, Doc, you can appreciate this. It's been important for me, as I stated earlier, when dealing with the health crisis in my left hand and a economic crisis in my right hand. I'm not choosing the conjunction or and choosing between them. I'm using the conjunction and I have to engage them both at the same time. And I think it's important as elected officials that there's not separation or distance between us and the health officials. And I am going to lean and yield on them and take their guidance, take their advice, in understanding what we need to do from a health care standpoint and a health crisis standpoint before I just open back up the economy, knowing that if I do that too fast, I can risk putting people's lives in jeopardy. And I think when you use the conjunction and engage those are both at the same time, there's balance here. And then finding that balance, then what are the recommendations to me at today, April 14th and going forward, is around what is our health officer suggestion we do. Do I want our economy back open? Yes. Are we dependent on that economy to be open, to deliver city services because it's taxes? The answer is yes. But should that be at the cost of lives? No.
There's another question I'm going to read. I don't see us getting this virus under control until everything is closed down for at least a week or two. And what about the people in these stores working and in these children factories?
Very fair question. I think there has to be a balance here. There is no situation where everything can close. The reason is because as humans, we have to eat. We have to, some of us have to get from point A to B. And so just, if you just go with the isolated example of nourishment and food, then you can't close grocery stores. You can't close Walmart or Sam's because they sell food.
Mm-hmm.
You can't close gas stations, believe it or not, because they sell some form of food. You can't close corner stores or gas stations and convenience stores or dollar stores, if I didn't say that. But guess what else? People need pharmacy because we still need our prescriptions. So you can't close Walgreens. You can't close CVS. And so just like doctors, just like nurses and other medical professionals, I am a true champion and cheerleader for those on the front lines working in these type of example stores I just named, because they are sacrificing themselves, because people like you and I still need to get to the grocery store, or still need to buy our pharmacy. No different than you still have an expectation that when you put your trash out, that city employees are supposed to pick it up. That if you needed some form of a 911 service, that a city employee is supposed to pick up that call, and a police officer is supposed to respond, and a fire or paramedic is supposed to respond.
We're back to the trash bags. Frank says COVID-19 can live on plastic for up to 5 days. Jamil says that doesn't make sense to me. It doesn't make a difference if it's bags or bins. I can't see how it will protect from any germs that would be on the can. The employees wear gloves. Gloves are preventative.
What we've seen is a 25% increase in household refuge. When you pick up bags, she's right in one sense. But what we've seen is more people working from home, more children being at home, and there's more trash to pick up. Because there's more trash to pick up, bags are not only heavier, they're more likely to spill open. And he's right. The probability of more, as much germs or some form of contamination being in a bag and being in a actual can is probability is the same. The difference is if that bag becomes open or bursts. And so we do want to encourage those who can put your trash in that actual can, because the question centered around is there's something we can do to protect our employees more.
Got it. I want to get back to the economy, if you don't mind. Before this was going on, it seemed like things were really going well for Birmingham economically. And I'd like you to comment on the economy before COVID, now during this crisis, which seems pretty grim, but it's probably that way for everywhere. And then where we're headed as a city, as a community.
I think pre-COVID, I was pleasantly surprised every single day to see the continued growth in our community. That small businesses, big business, mid-sized business took risk here and was very successful in taking risk here. The return not only for that business owner, but their customers, the return for the city, everyone was doing well pre-COVID. I think during COVID, this has been extremely hard. Doc, I want some of your viewers to know that this is a tough time, not only for the small business owners, but so many people in so many fields. And we're getting through it as best as we can, but it's very challenging. Post-COVID, I think the resiliency that exists in this community, Birmingham will come back strong. Birmingham strong is not just a play on words. It's power in those words, because we know this community and this city has been down before. We know the history that exists here. And I think that this city has a history not of falling on hard times, but knows how to bounce back. I am confident in my role as the #1 cheerleader for this city we will bounce back, and we will bounce back stronger than we were pre-COVID. We just have to get through this, slug it out, and come out harder on the other end.
I'm actually a little bit happy that the World Games has been postponed a little bit. Hasn't it been postponed a year?
It has been postponed 1 year. It's postponed to July of 22 now.
And I think that gives us an extra year to get ready. So
more logistics, operations planning, fundraising, venues, all of the above.
I'm really excited about that. I hope we can get squash here. I'm not sure you know what squash is, but it's a sport that's part of the World Games that I hope can come to Birmingham. And I want to thank you for your time.
Thank you.
If there's anything we can do on Doc Talk Live, please reach out. We'd love to, put any information that y'all deem appropriate and helpful to your cause would be great for us as well. So
thank you, Doc.
Thank you.
Thank you for being a voice. Thank you for being a voice, and what you're doing here and sharing information, and your audience, it means a lot. So thanks for having me on. Happy to be on, and thank you to your viewers as well.
Thanks, Mayor. Appreciate it.
Yes, sir.
Let's see here. Stop stream.